Good afternoon, everybody. This is Professor Demito, and I wanted to speak a little bit about subjective and objective history. I know I posted a presentation on it, but I thought that I would go into a little more detail as to how I want you to write your notes, because right now you're transitioning from your role as an RN to an FNP, and in doing so, you're going to have to change the way you document. So as a healthcare provider, we document SOAP notes, and you'll be learning about this more and more as you progress through the program. But I like to get everybody started right from the get-go on the right formulation of developing your notes. So when the drawers opened on Monday morning, it asked you to put together lists of the subjective and objective history. And I'm going to show you exactly how you provide some organization to that list. When you're documenting, you always begin with the chief complaint. That's the first thing that you document. It's a concise statement, and it consists of the one or two words that describes why the patient came to see you today. So it doesn't go into a great deal of depth or detail. It is short, sweet, and to the point. For example, my patient came in today for a sore throat or leg pain or my stomach hurts. So it's just one or two words that describes why the patient came to seek treatment today. We're going to expand on this in the history of the present illness. So I want to know, through the history of the present illness, all about what's going on. Now, if there's something about the past medical history that pertains to this complaint, then she can talk about it or he can talk about it. But otherwise, I want to narrow the focus of the history of present illness to this particular complaint. So let's use the example of a sore throat. I developed a sore throat 3 days ago. It is a very sharp pain and it's constant. I tried to take Tylenol and it doesn't help very much. My pain is a 10 on a scale of 1 to 10. I've not been around anyone who's sick, so I don't know how I could have gotten this. I don't have any other symptoms, just the sore throat. And remember, subjective is what the patient tells you. So I am scribing a story that the patient is telling me, and sometimes I need to ask questions to guide that material, but most of the time, just talking about what the patient is complaining about, what brought them to the clinic. A good way of organizing the information in the HPI is by using the old carts method. So let's use my example of the sore throat, the onset. 3 days ago, it was a sudden onset. Sometimes it's gradual. It's my throat. The duration is 3 days. The character is sharp. There isn't anything that makes it better or makes it worse. Does it radiate anywhere? What's the timing? Is it worse in the morning, worse in the day? And then a pain scale. And that timing can be important. I have some patients that say, oh, my throat hurts, but only in the morning when I wake up. Then I cough a bunch and I'm okay. Take a shower. So that leads me to believe that maybe this is postnasal drip. So all of these factors are important. And all of these components can help guide you in the development of that HPI. I like to really stress this, that CC, your entire visit is going to be based on the information you gather in the CC. So fully understanding that chief complaint is incredibly important in the physical examination that you do. Anything that you have spoken to on the chief complaint and the history of present illness needs to be examined further on in the visit. Okay, so now we're going into the history portion of the subjective part of our note in the SOAP note. And past medical history is important. Now, sometimes if a patient is established in a medical practice, you're already going to have this information in there. But we're stating that our patients, we don't have any background history on our patients, so we need to ask this question. And I generally will ask the patient, do you have any chronic medical conditions that you're treated for on a regular basis? And sometimes patients will say no. And then when I get down to the medications piece, they list all these medications, and I say, well, why are you taking these medications? You said you didn't have any conditions. Oh, well, I don't have high blood pressure anymore because the pill fixes it. So then I'll have to go back into the past medical history and add those things: hypertension, hyperlipidemia, asthma is a big one. Sometimes patients feel like if a pill is taking care of it, or if they're not having an issue with it now, it's not a past medical condition, and that's not the case. Past surgical history. I want to know if the patient's had any surgery in the past: gallbladder, tonsils, adenoids, anything like that. Family history. What runs in the family health-wise? Like asthma, heart disease, diabetes. Autoimmune disorders, I'm finding, are a big thing that is familial. Cancer, any breast cancers. Social history. Now, this is a really big one. And it's because I want to know the condition that the patient is presenting me with. Do they have a compromised immune system because they smoke and drink alcohol 4 times a week? Are they working? Are they in school? Are they incredibly stressed out because they're working and they're in school and they have 3 children? And so when you're obtaining this history, it works so much better if you have the patient sitting in a chair and you're looking at them face to face, and you just ask them questions to help guide them in the answers that they are providing to you. Listen. Listen to what they have to say and encourage them to talk. It's not our time to talk, so anything we say is just kind of a little bit of a prompt for them. So tell me a little bit about your social history. Have you ever smoked? And when patients say yes, they smoke, I don't ever make them feel bad about themselves. They know they shouldn't be smoking. And I want to know how much they smoke. And, if you need any help, when the time comes that you'd like to quit, we can certainly help you with that. Alcohol use. How many alcoholic drinks do you think you have a day? And that's a good way to get people to honestly think about how much alcohol they drink. What kind of job do you do? I had a patient once that was a plumber, and he came in totally congested and really, really having asthma issues, and he was just a mess. And in talking with him, I found out he was a plumber. And at that period in time, we had some horrible flooding in the area of which I practice. And I found out that he'd been working in this old home that had been totally flooded out, and he was having awful allergies. Drug use. Do you use any drugs? I'm always surprised because patients are often very free with the information that they, yes, I smoke marijuana, or generally that's what they'll admit to. Diet, exercise, sexual preference, all important pieces. Immunization status. I want to know if your immunizations are up to date, because as a nurse practitioner, one of the important things that we do is preventative health care. And if we have an opportunity to provide patients with immunizations that they may be lacking, I'm going to take advantage of it. So it's very important to know what their immunization status is. Reproductive history. When was your last menstrual period? Do you have any children? Are you using any birth control? Are you sexually active? Those things are important when doing our history. Also, if I'm going to dispense any medication, I want to ask them if there's any risk of pregnancy. If I'm going to be doing an MMR immunization, is there any risk of pregnancy? Because that may change our treatment. Medications. I want to know all the medications that the patient is on, even vitamins. black cohosh, soy, supplements, tart cherry, turmeric, anything they're taking, I want to know. And something that I have found is many patients don't have a clue of the medications that they take. So if they don't, I ask them when they get home to write it down, and I'll make a notation on a blood pressure medication they don't know the name. So at least I have it in the medical record that they are on some type of an antihypertensive. And then I strongly encourage them, you know what, you really need to write all those things down and keep it in your purse or in your wallet, because you never know when you might need that. Allergies, not only to medication, but environmental allergies and food allergies, very important. Now, there is a difference in allergies. I want to know if you're really allergic to it or if you just get a stomach ache when you take erythromycin. Most of the population gets a stomach ache when they take erythromycin. It doesn't mean that they're allergic to it. It's a side effect of the medication. Also, I've just read in the literature that if someone states that they're allergic to penicillin, that it really would be a good idea for them to go to an allergist to determine whether or not they actually do have a penicillin allergy. Research is supporting this because due to antibiotic resistance, penicillin may actually be a drug that is very helpful to us, because so many people state they're allergic to penicillin, and actually the research states that only a very small percentage of people who state they're allergic to penicillin actually are. Now we go to the review of systems. This is the last piece of the subjective history. In the review of systems, it is a inventory of all of the body systems identified through a series of questions. Now what we do with our examinations in the office is that we only need to touch on key symptoms that have been mentioned in the CC or the HPI. We always have to mention at least 3 systems, but I'm going to show you a trick. Now, let's start over again, and I want to show you how I expect you to document these case studies. We're going to start out with the subjective piece, and that's what we're going to work on this week. This week we're going to work on subjective and objective data procurement. So how do I get the subjective and objective information? That's what we're going to be working on here. Start with the CC, the chief complaint. Those 1 or 2 words that describes why the patient came to see you today. So in looking at your case studies, what brought the patient in? That's your CC. Now, all documentation of the examination is related to the patient, what has been based on the information you've gathered from that CC and HPI. So the HPI is next, the history of the present illness. Focus on the chief complaint unless there are other factors that are related to it. If I have a patient that has earache, I'm going to ask them, have you been swimming over the last couple of weeks or so? If I have someone with a rash on their legs, have you been in a pond or a lake? Because all of those things are important to the actual diagnosis. The HPI is going to expand on that CC, use the old carts that's going to help you gather the information that you need related to the symptoms. Past medical history, past surgical history, family history, social history, immunization status, allergy, and medication. Now, I realize that your cases may not have all of this information in there, but I still want you to write it out. Past medical history, you can write PMH, and then next to it, you're going to write not applicable or not stated, something like that. But I want you to get into the habit of formulating a proper SOAP note. All right. The review of systems. Now, it's important to understand that when you're documenting the review of systems, it's not necessary to list each system individually. It's okay to document a few pertinent positive or negative findings and then say all other systems were reviewed and are negative. It's absolutely fine to do that. or you can write, or you can make a note that says all systems negative except for those covered in the HPI. So that's review of systems. So you're going to have a review of systems or ROS area. And I'm certainly okay with you writing in there all negative except for those mentioned in the HPI. All right, so now we are going to go to the next step. We've covered the subjective, which is what the patient tells us. Now we're moving to the objective, what an FNP sees. It always starts with vital signs. Height and weight need to be done. Height, sometimes we don't do it every visit, but weight needs to be done at every visit because we need to keep track if there are any changes in weight, whether they've lost a lot of weight or they've gained a lot of weight. It's very important. And I have all of the body systems listed out here. And when you're doing your examination, you're only going to examine and document on systems pertinent to the CC and the HPI. So it's not necessary to do a head-to-toe examination on a patient who presents with pink eye. However, you do generally, I always go over, I always document on the general alertness of the patient. Patient is alert, awake, alert oriented, or a patient is interactive, and then comment on the ears or whatever they have come to. We need to document on 3 things, and you're going to learn this as you go on further in how you code and chart code your charting. The reason we document the things that we do is not only so that we can help guide our differential diagnosis with the information that we've gathered, but we also need to do it so that we are maintaining the our charts for coding purposes. So in order to bill for services, insurance companies require that we have certain components of our chart or else they won't reimburse us for services. For example, if you submit a chart without a CC, the insurance company will not pay for it. If you submit a chart without an HPI, the insurance company will not pay for it. If you submit a chart that only has 2 body systems examined and you coded it at a specific level, the insurance company will say, well, you only examined 2 body systems, so we're only going to give you this much money as opposed to what you had requested for this exam. So lots of considerations when we're doing our documentation, and you're going to learn more and more about this as we move forward in your education. So the documentation of the subjective piece is going to be your CC, HPI, PMH, PSH, FM, oops, this is supposed to be family history, sorry about that, social history, immunizations, allergies, medications, and the review of systems. Those are the components of the S in the SOAP note. The objective information, or the O in the SOAP note, vital signs, and then examination of the pertinent systems. Now remember, I want you to write all of these things out. You're not going to have all of the information, but I want you to write it out so that you get a good understanding of how to formulate those SOAP notes. Next week, we will go over the A and the P of the SOAP note. So I certainly hope that this information helps you as you begin those first cases, and don't hesitate to reach out to me if there's anything that I can do to assist you.